The following video presentation is a preliminary report on an ongoing clinical investigation comparing respiratory infectious disease analysis on samples of nasal washings versus a new flocked nasal swab. Nasal washing is currently the method of choice in many hospitals for obtaining samples of nasal secretions from infants with respiratory tract symptoms. This method is safe and effective, but is cumbersome. The saline volume can dilute target analyte significantly, and samples must be kept frozen or transported on ice. Flocked swabs, together with UTM, may be a viable and more convenient alternative, and this study is intended to determine if flocked swabs are as effective as nasal washings. This study is a collaborative project between the Emergency Department at Kern Medical Center in Bakersfield, California, and the Molecular Research Lab at Medical Diagnostic Laboratories in Hamilton, New Jersey. Dr. Paul Walsh, head of pediatric medicine at Kern Medical Center, has a particular interest in studying the pathology of various genotypes of the RSV virus. Babies who are presented at the emergency department with bronchiolitis can have anything from a runny nose to severe breathing difficulties. Sometimes, however, these babies just stop breathing. As well as evaluating flocked swabs versus nasal washing, this study is investigating 1. If certain viruses cause babies to stop breathing. 2. Are certain strains of RSV to blame, and is there a reliable gene marker that determines virulence? 3. Are there other bacteria or viruses in babies' nasal secretions that contribute to difficulty breathing?
I'm Erwin Harris. I'm the Chief Medical Officer at Kern Medical Center. Kern Medical Center is a 222-bed facility serving an underserved population of about 400,000 in the local area and a county population of about 800,000. Our emergency room treats about 53,000 patients a year. We tend to have a higher incidence of bronchiolitis, particularly in children under age 2, for which we see about 250 patients in the emergency room every year. The average income of the people who live in the county is only $19,800, so you can see that this is a very needy population for both adults and children. Our emergency room residency program has been in existence for 30 years, is affiliated with UCLA, and in addition to that we have a transitional program, family practice, internal medicine, surgery, obstetrics and gynecology, psychiatry, and family practice residency programs.